Ready to go? All right, how's everyone doing today? Good. I'm glad to see everyone out here. I appreciate you coming. We have a really great turnout for everyone who's not here and is going to view it online on YouTube. Thank you for tuning in. And so we're going to start out with our upright and all right presentation, and we're going to be talking about all the different disciplines and how their role in helping with fall prevention. So as far as we're going to introduce your outpatient therapy team. And so we have Kyle Marshall. He's our DPT in physical therapy. So he's our doctorate. We have Kayla Cothran, and she is our physical therapist assistant. Both of them are also in home health, so you might see them in the homes in those services. You have myself. I'm Chris Rivera. I'm the outpatient therapy supervisor, and I'm also a physical therapist assistant. We also have for our occupational therapy, we have Crystal Rivera. We have no relation. She is a master's in occupational therapy, and she also is the occupational therapist in home health as well, so you'll see her there in the home. And then for speech therapy, we have Mandy Greenberg. She is also everywhere, so you will see her in the inpatient skilled nursing facility. You will see her in home health, and you will also see her in our outpatient therapy. And so that is your outpatient therapy team. As far as our team, our physical therapy team gets called physical terrorist a lot by y'all. And it's a nice little cute little nickname. I promise that all the thank you cards that are in the office no one was held against their will to write those. Those are all very genuine, and we thank you for them. All right, so why fall prevention matters. So falls are the leading cause of injury among older adults, unfortunately. And the injuries from falls, they definitely can impact your quality of life, and unfortunately. We definitely want to prevent those, keep you living a nice, healthy life of everything you want to be doing. What we'll go over today are simple habits and things that you can change in your lives and daily habits to create to help prevent these falls, as well as how we in our therapy disciplines help with that together. So as far as the impact of falls, unfortunately, 1 in 4 older adults will fall each year. We definitely believe we can get that to 1 in 5, 1 in 6, 1 in 7. And unfortunately, with the falls, 95% of those, they occur to be hip fractures in older adults. And then 1 in 5 falls results in a serious injury, like broken bones and head injuries. And so, again, we want that number to be more spread out. Once we get the number of falls from 1 in 4 to 1 in 5, 1 in 6, 1 in 7, we'll reduce that, and we'll reduce that together. And again, a lot of those can be done with what we'll go over today and then simple steps at home. So where do those falls mainly take place? I'm the one who does a lot of our independent living fall screens, and so I get to see firsthand in our community where most of these falls take place. Most of them are in the home, and they're also in the sidewalks, so anything that's a transitional. And unfortunately, what we'll see is there are going to be 2 main reasons that we see essentially for those falls: in the homes and in sidewalks, and they go hand in hand. That's going to be lack of strength, and then as well as awareness. And awareness is going to be with environmental awareness, so external factors, and then also internal awareness. As far as with the awareness side of it, the example I like to go with is that when we're young, we have the luxury to walk and talk and have some distractions going on while we're moving around. And, for someone like myself, I do that all the time. I may trip, but I usually have the strength to walk and talk, and if I trip, I catch myself. Unfortunately, as we age, and especially when we don't have, maybe we're not exercising as much, it's very natural for our bodies to lose some of that strength, and as it does with the muscles, but it also does with the bones a little bit. So let's say for me and a younger individual, and I was to trip, and I actually did fall. My bones usually would be strong enough to handle that impact. As we age, unfortunately, our bones start to get a little weaker and they may not handle that impact as much. So staying strong is very important, but also our awareness. We may have to be a little bit more aware of focusing on movement tasks versus the nice distractions of walking and talking necessarily with a friend or enjoying the nature and the environment, like when you're outside walking about. A little bit more emphasis on the movement will go a long way. And it's just one of those things that's just part of life. Now, as far as the strength component there, we don't necessarily have people doing squats with the barbell, not necessarily, but we definitely have people doing squats and getting up and down through chairs. One of the ways that we can be a little bit more aware within ourselves is a simple assessment screen that everyone can do or try to do is get up from a standard chair, like the ones you're sitting in now, without using your hands all the way up and all the way down. If you can do that, great. You are actually more indicative of having a lower fall risk. If you cannot do that, that's one of those indications that actually puts you at a higher chance to have a fall, so be at higher fall risk. And that's a simple, safe to do assessment that you can do to be aware of yourself of changes in life. And if you see that, definitely what this would be is speak up. So this is the 4 pillars of the CDC, and this is their STEADY program, which is Stop Elderly Accidents, Deaths, and Injuries. And their first pillar is to speak up, is taking notice to things and speaking up for yourselves and getting help if you need it. And that's what we're all here for. And so other than speaking up, you have the keep moving, and you'll see later with the other disciplines, going over eye health. So definitely go, check your eyes, go to your doctor for that. And then making your home safer. And we're going to get a lot more into that with some of the different disciplines. So this is just a wrap up before we start introducing our therapy teams. It's never too late to take the first steps to prevent falls. We see people from every different base level, and we're able to help you get better to prevent these falls from any level. Okay. And so without further ado, I'm going to introduce Kayla. She's going to be doing our physical therapy portion. All right. Thank you, Kayla. And thank you again.
Morning. I see some familiar faces in the crowd. So as Chris mentioned, I'm going to be talking about the PT aspect of this. Just because, because of the aging process, just because falling tends to be a little bit more prevalent does not mean that it's a normal part of the aging process. So, that was it. Yeah. Did you guys get any of that, or do I need to repeat myself? Okay. All right. So, let's see. Set that down. So, let's talk about healthy aging and tips to prevent falls. So, what conditions are more likely to cause a fall? So, physical changes and health conditions, and sometimes the medications used to treat those conditions, make falls more likely as you age. So, some risk factors are lower body weakness, diet, dehydration, vitamin deficiency. Mandy will talk a bit more about good nutrition and properly fueling your body, but on the other side of that coin, which can be a sensitive subject for some, is obesity. The fact of the matter is the more excess weight you have, the more your endurance and mobility will negatively be impacted. You can talk to your PCP about different weight management options if this is a concern of yours. Alcohol consumption as well. I don't know of too many people who become more coordinated and graceful when they drink alcohol. And it can cause dizziness too. So then there's difficulties with walking, balance. There's vision and vestibular issues. So, I mean, if you can't see where you're going, that'll increase your fall risk. As far as vestibular goes, for those of you who have had vertigo, you know it's not fun. Hopefully, if you haven't had it, you won't get it. There's also, I'm sure a lot of you deal with aches and pains, foot pain, and then there's home hazards and dangers. Crystal will go over a little bit more of this, and as far as making your home and environment a little safer. Okay. So here's some strategies to help prevent some falls. Most falls are caused by a combination of risk factors. The more risk factors a person has, the greater their chances of falling. So maybe make an appointment with your healthcare provider. Okay, discuss your medications. Medications, make a list of your prescriptions and non-prescription medications and supplements, or bring them with you to the appointment. Your healthcare provider can review the medications for side effects and interactions that may increase your risk of falling. To help with fall prevention, your healthcare provider may consider weaning you off of those medications, or some of them, that make you tired or affect your thinking, such as sedatives, antihistamines, and antidepressants. Discuss any falls or previous falls you've had. Write down the details, including when and where you fell. Be prepared to discuss instances when you almost fell, but you were caught by someone or you caught yourself. And then details such as these may help your healthcare provider identify specific fall prevention strategies. And then your health conditions. Certain eye and ear disorders, like I mentioned before, may increase your risk of falls. Be prepared to discuss your health conditions and how comfortable you are when you walk. For example, do you feel any dizziness, joint pain, shortness of breath, or numbness in your feet and legs when you walk? Your healthcare provider may evaluate your muscle strength, balance, and walking style. Shoes. This is pretty self-explanatory. Maybe I don't see a whole lot of people wearing high heels, but high heels, floppy slippers, and shoes with slick soles can make you slip, stumble, and fall. So instead, wear properly fitting, sturdy, flat shoes with non-skid soles. And this can be a problem for those who have edema as well, because your water retention may fluctuate. So just make sure you adjust your shoes properly. Light up your living space. This one is also a little bit more self-explanatory. Just make sure that you have lights that are accessible. So if it's dark, maybe don't have a light switch or furniture in front of a light switch where you have to reach over. Have night lights around, so that way when you're walking around you have some idea of where you're going. Store a flashlight nearby, maybe in different areas throughout the house in case of power outages. Okay. And then Crystal will also have more suggestions about this. Use assistive devices. Your healthcare provider might recommend using a cane or walker to keep you steady. And a lot of people don't like the idea of that because they don't want to, using a walker or something might make you feel old, but again, that might be something that you need. Other assistive devices can help too, so like handrails, non-slip tread on bare wood steps, raised toilet seats, those kind of things. Okay? So keep moving. You've probably heard a body in motion stays in motion, which is very true. Physical activity can go a long way towards fall prevention. With your healthcare providers okay, consider activities such as walking, water workouts, or Tai Chi. Again, you don't necessarily have to lift these massive weights that Chris had a picture of earlier, but just keep moving. Talina's classes are a great resource as well. And if you avoid physical activity because you're afraid it will make you fall, that'll increase your fall risk because you're just getting weaker, okay? your provider may recommend carefully monitored exercise programs or refer you to physical therapy, which is where we come in. So physical therapy and fall prevention. Falls and fear of falling can diminish your ability to lead a full life. A fall can result in injury, loss of independence, a decreased ability to do the things that are important to you. In physical therapy, to improve your balance, muscle strength, and endurance can help lower that risk. A physical therapist can assess your risk factors, help you address those risks, and remain independent. So up here, if you see Kyle, he'll help design a personal plan for your specific fall prevention needs, help you make your home safer, educate you, teach you appropriate strength and balance exercises, all these things, okay? And I think it's Crystal's turn now. There you go.
Good morning. How's everyone doing today? Full disclosure, I want to say that I am expecting, and this little girl is coming in less than 20 days, so if I make a face or if I run out of air, let me breathe a little, and then I'll proceed with the actual presentation. But I am Krista Rivera. I am the occupational therapist over at John Knox. I'm primarily at home health and outpatient, and here and there I might be at Majestic Oaks. With occupational therapy, everyone seems to know what physical therapy is, but with occupational therapy, I won't help you find a job. I will actually help you with anything that occupies your time, right? So from the moment that you wake up to the moment that you go to sleep, anything that's meaningful to you, the things that you do on a daily basis, whether it's taking a shower, getting dressed, engaging in a meaningful activity. Maybe sometimes we need to incorporate different tools or equipment to maintain the independence that we want to keep. Or maybe it's just a matter of range of motion and strength and fine motor skills, okay? Then going forward, I am gonna focus a little bit more on your environment from a home health standpoint, just because of things that I've seen every time I actually go to people's houses here. So the first thing is just identifying the hazards, right? So sometimes we just need a second set of eyes or a different type of recommendation for us to know that something is unsafe. So in my presentation, there's going to be a lot of pictures. The left represents the things that might be hazardous, and then the things on the right are things that should be the way that they are, if that makes sense. So for number one, you see the rugs on the floor. You'll probably see that picture in all of the slides that I have, because throw rugs are everywhere in your houses, and I always recommend to either remove or try to hold them down with adhesives and things like that, just to take a preventative approach and actually minimize that risk of falls. For number two, you see electrical cords, whether it's for a phone or a lamp, or sometimes even if you have oxygen, the actual oxygen concentrators. So just kind of repositioning where we put those things so that if we're ambulating, we're walking around, we're not actually stepping over it or tugging on it. And then number three is just blocking pathways. Sometimes we put ourselves in that risk of going through very narrow spaces and we don't have a wide enough pathway. So just kind of removing and repositioning things around the house will just minimize the risk of falls, okay? So for the first image here, for number one, we have cluttered nightstands. We ideally want to have a phone, a lamp, or something of that sort, not too many things on the actual nightstand for safety. For the floor here, we have tripping hazards. I see rugs and shoes all the time, and when people are actually getting in bed, they're just kind of kicking it around. So don't put yourself in that risky situation. Let's put things in a different place. Let's make sure that there's nothing on the way. And then the last one here is the actual furniture. How I talked about on the first picture, kind of those narrow pathways for the chair here, we can put that somewhere else so that we have a wider pathway and not have to kind of maneuver through tight spaces. And then for the picture underneath, on number 1, that's poor lighting. A lot of the times if we're getting up during nighttime and we're going to the bathroom or we're getting a glass of water, we might not have those motion sensor lights, which are really convenient. I've seen them, you can actually plug it into an outlet, or there's battery operated ones that you can just put in different aspects. That way you actually have light when you're standing up and going to those places at nighttime. The second one here is your device. So whether you have a cane or a walker, 2-wheel, 4-wheel, I see a lot of people put it on the other side of the bed and then they walk 10 steps over to their bedroom. Again, if we're waking up at 3 a.m. in the morning, we're going to the bathroom, you don't want to increase your risk. You're already disoriented, you're probably a little loopy, you don't want to take a couple of steps and then have a fall, especially if we have things on the floor like the shoes and the rug and things like that. The last one over here is number 3, again, a tripping hazard. It could be your blanket, it could be a pillow that fell off, it could be the actual bedding, so let's make sure that we're tucking those things in or just being aware that those things can cause a fall whenever we're standing up, especially at nighttime. And then for here, we have kitchen for number 1. I actually did this with a resident recently. She had a whole cabinet on the top right full of cups, and then all her plates were on the bottom cabinet. So I was like, you don't need all 30 cups in that one area, so we kind of modified her environment, put a couple of things within reach so that she doesn't have to bend over. That will also minimize her back pain because she was having some. She doesn't have to do as much of that because of the modifications that she did in her kitchen. For number 2, you see the rug again. They're everywhere. If I step on it and I can shift the rug around, get rid of it, it's just the safest option. And then for number 3, if you guys have pets, bowls, toys, just don't keep them in those common areas that you're constantly standing by or going through. You can put it in front of a wall or anything like that. That would just minimize the risk of you having to step on it or hit it, or it being in the way whenever you're not necessarily paying attention to what's on the floor. Then for the bathroom here, thankfully over here at John Knox, we primarily already have grab bars by the toilet and the showers and things like that. Sometimes they might not be in the correct place or the correct length based on what you need it for, especially if you're a little taller, a little shorter. But for the most part, they're there. Something I typically find myself doing especially is putting in a maintenance ticket for replacing the towel racks for actual grab bars. We see a lot of people going into the shower and holding on to it. Those aren't on studs and those wiggle around. So with time, excuse me, I see that they start getting looser and they could eventually come off, especially whenever you guys are reaching for it. So that's something that you guys can do on your own as well if you find yourself seeing that you're reaching for that towel rack as you're going in and out, and just call maintenance and see if they can implement that into your bathroom. For the second one here, lighting as well. Number 3, we're looking at the rug. And not just rugs in the bathroom. I see also people putting towels. So if you put a towel right when you come out of the shower, those are even more slippery. So I would definitely recommend to not put anything in case you were actually considering whether it's a rug or a towel. If it is a rug, we want that rubber backing. And in a couple of slides, I'll show you guys different things that you can incorporate. And then number 4 here, it's just adaptive equipment. A lot of the times over at Valencia in the cottages, they might have a built-in bench or a shower chair. I always recommend those things, not so much because you need them the whole entire time, but there might be a time or a day, depending on the time that you shower, what you did that day, that you're feeling a little weaker or a little more off balance. So just having it accessible to you, especially if you're doing if we're washing or rinsing our lower body, let's go ahead and sit down and not risk the fact that you're going to be standing on one foot and trying to reach different places. You have soapy hands, you're holding onto the grab bar, and then we can have a fall. And then for here, if you guys are absolutely against removing the rug, we have these adhesives that go underneath the rugs here. They're about $10. They come in a pack of 20, so that's something that you guys can incorporate in case, again, you don't want to remove because you absolutely love how the rug looks, but it's not the safest. My recommendation is always these rugs here. Whenever you actually buy them, you'll feel the back that it has that rubber backing. You step on it, you shift around, it's not gonna go anywhere. For the actual shower, I put here for a bath mat. Those are really convenient, and I actually learned from one of the residents that they recently purchased one that's kind of like a spongy loofah that goes on the floor, so it's kind of like a 2-in-1 where it's exfoliating and washing your feet, but it's also making the surface less slippery. And then there's also these that you can put individually on the floor to, again, make it less slippery. The only thing with this one is with time, they might change colors depending on like the soap or color that you use for your shampoo and things. So it still does what it should in terms of that extra grip to reduce your risk of falls inside of the shower, but that's the only drawback. Excuse me. And then these are the motion sensor lights that I talked about. A pack of 6 might come out to like $15. You can find those at Amazon or Home Depot, Ace Hardware, and you can put them in different parts of the bedroom or the bathroom. Sometimes when you walk into a bathroom, the light is not immediately at the entrance. It might be a couple of steps into the bathroom. So again, just maximizing where the light is coming through whenever you're actually going to different areas of the rooms. And then in the kitchen, it's helpful as well. And then the last one here is just walker cane safety. We want to make sure that you guys have the correct height for your devices. Whenever you guys are doing kind of like a quick assessment on yourself, if you relax your hands, your hand grips should be at the crease. So that's how you know that that device is at the appropriate height, so don't go switching around your walkers because it's not one size fits all. Making sure that we're locking the brakes before we sit down and keeping the brakes locked before we stand as well. I see a lot of people trying to pull from the walker, and if it's not locked, that can cause a fall as well because you're making yourself back to the chair. And then Kayla touched on the shoes, making sure that they have enough tread and they're non-slip just to maximize safety overall. And now we have Mandy that's going to go over the speech component.
Hi, my name is Mandy. I'm going to talk a little bit about how I help people at John Knox Village, and that's typically with cognition or with difficulties swallowing. Let's see. Oh, there we go. Okay. So older adults with mild cognitive impairment or certain types of dementia are at higher risk of falling, and it's a significantly higher risk. Some studies are saying 2 to 3 times increased instances of falling in comparison to someone who's cognitively intact. So declining cognition can lead to things like poor judgment, increased impulsivity, as well as reduced processing speed, which can lead to reduced reaction time. Memory issues can also cause decline in safety awareness because of decreased ability to remember safety sequences, also forgetting to use assistive devices. Okay. The first step in identifying a cognitive impairment is by using a tool to kind of see how that cognitive impairment is affecting you. We've got a lot of tools to be able to do that. Let's see. And then we can use things like cognitive interventions to help reduce risk of falls. So things like cognitive retraining, errorless learning, vanishing cues, as well as using scenarios to help with recognizing hazards. For memory, we can use external memory aids. I know Crystal touched on those, as well as things like spaced retrieval to help people gradually memorize safety sequences. Okay. I also help with people who are having difficulty chewing and swallowing food, so it's important to maintain good nutrition. So eating healthy food with adequate energy and protein is important to maintain muscle mass, muscle strength, reducing risk of things like muscle wasting, frailty, and then of course fall-related injury. Okay. When people don't consume enough good food or water, they lose muscle mass, they can become unsteady. Obviously, if you're dehydrated, you can start feeling weak or dizzy, which increases your risk. I guess just threw in here some protein helps build and repair body tissues. These are some good examples of proteins that you can add to your diet. And then to talk a little bit about dysphagia, so one cause of decreased nutrition and decreased hydration is due to actual difficulty with chewing and swallowing. So difficulty swallowing, that's when you see people when they're choking during their meals, when they have increased coughing, you see things like watery eyes, becoming short of breath. Obviously, if eating food becomes uncomfortable or honestly sometimes dangerous, you're going to eat and drink less. So just signs and symptoms of aspiration of things going down the wrong way, going into the lungs, to be wary of. Is foods feeling stuck, pain when swallowing, trouble starting a swallow, almost feeling like the food's stuck in the mouth and you're trying to transition it down and it's just not happening. Coughing or wheezing after eating or drinking, having that wet sounding voice. So almost like there's a frog in your throat while you're eating and drinking and the voice changes. Some people will actually have an absence of voice altogether as they're eating and drinking. Shortness of breath, again, that watery eyes, runny nose, but also increased frequency of upper respiratory infections, increased pneumonias, and you don't really know the reason why. So all those things will, obviously lead to malnutrition, may lead to weight loss, may lead to weakness, dehydration, increased risk of overall falling. So definitely getting help for that, because we can do things in speech therapy, help build up that muscle strength, that muscle coordination to help with that swallow, or evaluating the diet and see what's causing the problem to make eating easier and to make sure you're maintaining that nutrition and reducing those risks of falling. Okay. All right, so that was my part. I'm going to turn it back to Chris. Thank you so much for your time.
There we go. All right. Thank you, Mandy. Thank you, everybody. As far as this is just some resources. As far as the CDC, a couple different links so where you can see facts about falls, get a little bit more information, some visuals for yourself at home. And then there is also the link there for the NI and NIH for the government resource as well. As far as this is our portion, then we'll open things up for Q&A. So all of us are available here to answer. If you have any specific question for someone specifically, we'll pass the mic so that way they can answer. And then Candace is back there with mics to give to you to ask a question. So anyone have any questions at the moment? Perfect. And then Candace will come around and give you a mic.
I'm not familiar with the term dysphagia. What exactly is that?
That's any kind of
That's
any kind of difficulty chewing or swallowing. So it's 3 different phases. So people might have difficulty chewing their food and as a result don't get proper nourishment. So that would be an oral phase. There's also pharyngeal phase, which means the muscles in your throat aren't working correctly. So that would apply usually to someone who, let's say, drinks water. And that water, even with small sips, seems to go down the wrong tube a whole lot. And you end up with that coughing, turning red, that sort of thing. And then you have the esophageal phase of difficulty swallowing, which can be any number of things, maybe a stricture, an area where that esophagus is tight, and leads you to feel that almost kind of clog sensation in the chest. So it's unfortunately fairly common, especially as people get older, and we definitely want to get the jump when you start experiencing those kind of symptoms to make sure that's something that's corrected so there's not further problems down the line, like malnutrition.
All right, thank you so much. Any other questions at the moment? Perfect. Right there in the front. Got it now.
I don't have a question, I have a statement that I haven't heard anybody mention. I have found out that calling maintenance when you cannot reach something, whether it is up above your head or down below your waist, because a lot of us, we can get down and look underneath the bed, but we can't get up again.
Gotcha. So how to get up?
No, it's important thing is that's when you're supposed to call maintenance, because they are
True.
very good coming over to help you.
Absolutely.
And especially if you have stuff in the top part of your kitchen cabinet, there's no way you can reach it safely.
Absolutely. That is a great statement to make.
Please.
100%.
Yes, please call maintenance.
Absolutely call maintenance and ask for help. Thank you so much. Right there up front.
I know you collect information on falls, where they occur and how many falls there are. What happens to that information and what does John Knox Village do with it?
That is a good question. It's a very good question. We're going
I'll
to pass
take
it
the
on
answer.
to Nicole. Perfect.
Oops, sorry. Hi, everybody. I'm Nicole. I'm the Director of Clinical Services at John Knox. I'm the nurse amongst the group, not the therapist. But we do track falls amongst the village. We track and trend those. And if I see your name a lot, then we're probably going to send one of those people out to see you or call you, because we don't want to have you have a fall that results in an injury. So we do kind of monitor for recurrent episodes. And typically with a fall in independent living, you might get a call from Chris. I'm told to stand in front of you. You might get a call from Chris because he typically does my screens for independent living. We do the same thing in assisted living, and either Kayla or Crystal will do that screen in assisted living. And then at Majestic Oaks, those therapists do theirs as well. So we kind of monitor falls all over the campus because of the significant risk for injury. Yep. So if I know your name, you might be at risk. If I don't have any clue who you are, you're probably doing great. Questions?
Cool.
I just wanted to ask the OT, where do you purchase those things, the sticky things to put at the bottom of the rugs or?
The best option I always find is Amazon, but I have also seen if you want like an actual local store, Walmart has them as well, so that if you go to like the crafting or the actual like rug section, you can find packs of those.
What would they be called?
They're non-slip rug adhesives.
Okay, thank you.
Although we just
Sorry.
prefer to see a large number of throw rugs make it to the dumpsters today.
Yes, definitely. I do want to address and go back for the screen question. Whenever we reach out to you guys, it's really just more of a chat like, hey, how did this happen? Would you like me to come over, take a look at your environment, see if there's any functional decline? And then if so, then we'll get a referral and actually start you up in therapy depending on what we find, okay?
Thank you, Crystal.
Does everybody know that we do free screens from the therapist?
Chris, would you please address, and I can't remember the name of it, the item that you put outside the commode? If you don't have bars, grab bars, not all units have the availability of being able to attach your grab bar, and then you can buy one of these things to hang on to when you're going up and down.
There are also, especially if you have like a tub, there are some that you can attach to the actual tub. Where it's kind of like a grab bar that goes on top for you to go in and out. I know sometimes grab bars aren't ideal if it's like a pocket door, but there are also suction grab bars that you can implement into the actual shower or the wall, right next to where you're going in and out. But earlier, I recommended to replace your towel racks with the actual grab bar just because they're sturdier.
Well, we're in a Silverstone, and in the guest bathroom, you cannot put a grab bar either way because you've got the tub immediately there, and then you've got the sink area on the other side. So we work through your people, and we order this item, and it works.
Okay, awesome. You can let me know too. If anything, I would love to actually come over and see what has worked for you guys for then us to implement to other people that live in that same street.
And you can get those through John Knox. They'll order them, work with you on it, and install them.
Okay. They want me to talk about toilet frames instead of grab bars, which are the most ideal. Sometimes if we have a toilet, like an actual grab bar next to the toilet, you're kind of pulling on yourself instead of pushing off, which is over time, if you're pulling, bad body mechanics, normal wear and tear, especially for your shoulders. So things like an actual frame to actually stand up from whenever you're coming off of the toilet is typically more ideal. But it's also more so a preference. Can you actually get up? Is it sideways? Is it vertical? So we just have to kind of assess the environment to see what's best for you guys.
Right up front again.
What do you do if you see a neighbor fall and you go over to help and they say, please help me up, but don't tell anybody? What do you do?
Nicole's coming for that one.
Nicole's coming for that one.
Tell me anyways. So we hear this a lot, right? We always hear, if Stephanie shows up, I'm going to Majestic Oaks. So how many of you sitting in the room have had a visit from Stephanie before? And you're all still here. Okay? We can't help if you hide issues from us. Just because you experience a fall doesn't mean we're sending you to Majestic Oaks. If I did that, my home health department and my outpatient therapy would collapse. They would have no business. Please, if you have something that happens, let us know. I talk about this a lot when I do my chats in terms of neighbors helping neighbors. And some of you are very, very helpful. And then eventually we get a call that says, I can't take it anymore. My neighbor is very needy. I take them to all of their doctor's appointments. I go over and I help them every day to get set up. I take them with me to meals. I go pick up their prescriptions. And they call me every time they're not feeling good. And then sometimes it's too late for us to intervene with the neighbor. They may have gotten so weak and so impaired that we can't put in safe interventions in their home. So where we appreciate that we have a very neighborly community, I need you to reach out to either myself or to the medical staff so that we can assist in those situations. Please. Other questions?
To follow up on Tony's question, isn't it also true that if someone falls, we should not be helping them up for fear of hurting them or ourselves?
Absolutely not. You should not help your neighbor up, because I can give you a laundry list of dual falls. The resident fell, then the neighbor bent over to help them, and they both ended up side by side on the floor. It happens with spouses too, because they try to prevent the fall from happening, and then we get a call that there's two down. So please don't do that. You can injure yourself. There are certainly proper body mechanics in getting someone up off the floor, not to mention that the person may actually be injured, right? If they have a broken bone and you move them without a proper assessment, we can do permanent damage to that person. I'm such the bearer of good news all the time.
Thank you, Nicole.
This is on the lighter side, but I can't resist sharing this. I had gone through therapy, and between Kyle and Chris and Kayla, they had said, well, what is it in particular that you would like help with while you're here? I said, learning how to get up after a fall. So I spent some time doing that, and one day, as simple as on the chair, working in the freezer, somehow I twisted, turned, fell down on my knees. So I thought, this is a chance to find out how the therapy worked. So I took my foot and I kicked the chair as far away as I could, crawled over to it, went through the whole works, and I was really excited because I was able to do it. So the next day I go in for therapy, and I go up to them and I say, I am so excited. And they're going, why? And I said, I fell yesterday.
And my immediate reaction was, oh no.
Do you have any business cards that you could pass out? Because I really don't know the lady here.
Great question. We do have cards. Unfortunately, we did not bring any, but we will definitely get you some. Absolutely. Mm-hmm.
I just wanted to take a minute. I'm on the healthcare committee, and I wanted to just thank Nicole and the therapists, which I know are very busy, taking their time out to come and do this presentation for you. And I hope it makes a difference, even just a small difference, to prevent a fall at John Knox would be wonderful.
Thank you so much. Are there any stories that anybody has about therapy that anyone wants to share? All right, perfect. All right, so that's our presentation. Thank you, everybody, for coming out. I really appreciate it. We had a great turnout today.